As Nigerians join the Global Partnership for Action to eliminate all forms of HIV-related stigma and discrimination, stakeholders are calling on government agencies, civil society organizations, healthcare providers, and the general public to support action against HIV-related stigma and discrimination. Benedict Uko's report is read from our studio.
With an estimated 1.9 million Nigerians living with HIV, stigma and discrimination remain significant barriers to prevention, treatment and care. The Nigerian People Living with HIV Stigma Index Survey 2.0 report revealed that 22% of respondents had experienced stigma and discrimination, while 10.9% reported cases of human rights abuse. The UNAIDS Country Director, Dr. Leopold Zikeng, said global collaboration is needed in achieving the targets of the Global AIDS Strategy 2021 to 2026 and the Sustainable Development Goals (SDGs).
Anti-Discriminating Act 2014. Then, as we speak, I think only 18 states in Nigeria have domesticated, so that act. Am I correct, Gabby? 18. So we really need to do more. If we are passing acts, so in the House, and then they are not domesticated at the state level, and then we don't implement what we have agreed upon, it doesn't really make sense. What kills them is not the virus. What kills them is the way they look at them. They look at them in their own family. They look at them in the community. They look at them at work. They look at the children, so in school. I also remember a country where somebody was beaten to death, so I'm talking about the violence, which is related, so to HIV and AIDS. It shows what, brothers and sisters? It shows we need to redouble our efforts, so to make sure, so that as we want to end AIDS, we stand together with those who are infected. We stand together with the communities in such a way that we can end AIDS.
The Director General National Agency for the Control of AIDS, Dr. Temitope Ilori, represented by James Aninye, emphasized the importance of ensuring equal access to healthcare, employment and justice for people living with HIV.
Nigeria's commitment to the global partnership. By joining the global partnership, Nigeria commits to the following actions. Partnering with civil society organizations, communities of people living with, at risk of or most affected by HIV, UN partners, academia, private sector, donors and other stakeholders to identify policy and program gaps, design and implement evidence-informed interventions, and tracking progress in eliminating HIV-related stigma and discrimination. Assessing the current state of HIV-related stigma and discrimination in the country, or building on previous assessments to identify and implement human rights policies and programs to eliminate barriers to services.
Stakeholders also received concerns over the slow progress in domesticating the Anti-Discrimination Act of 2014, with only 18 out of 36 states having adopted the law. The Chairman House Committee on HIV and AIDS, Tuberculosis and Malaria Control, Honorable Amobi Godwin Oga, pledged legislative action to accelerate implementation.
We are aware that discrimination can be institutionalized through existing laws, policies, practices that negatively target people living with HIV and marginalized groups. Therefore, we must strengthen our institutions to dictate and expunge these discriminatory laws from our statute books and increase advocacy through education, awareness, campaigns, and sensitization of our people about relevant rights and laws and how persons living with HIV/AIDS can demand redress from abuses through the relevant laws of our country.
The Zero Discrimination Day is a global observance to end all forms of discrimination this year, holds particular significance for Nigeria as the country takes a historic step in joining the Global Partnership for Action to eliminate all forms of HIV-related stigma and discrimination.